All right, and we are recording. Let me go ahead. Perfect. Let me get my screen back over here. Good evening, everyone, and welcome to our masterclass this evening. Give me one second. Welcome to our masterclass this evening. Tonight, I'll be your moderator. I am the Chief Program Officer here with the NBDA. And tonight, this masterclass is going to be about perinatal mood disorders and anxiety disorders. Sorry, perinatal anxiety disorders. Sorry. But yeah, tonight we have Imani Byers-Quarterman. She is a full spectrum holistic doula and a clinical therapist based in Atlanta, Georgia. She's the founder of Rebirth Wellness and a co founder of Your Tribe Doula Agency, your Rebirth Tribe Doula Agency. Since 2020, she has supported over 100 or more births, bringing both clinical expertise and hands on experience with her work. Her work is rooted in mental health, fertility, birth, wellness, postpartum wellness, and she is deeply committed to ensuring families feel supported, informed, and empowered throughout their journey. Imani, we're so excited to have you with us this evening, and I'll go ahead and pass it off to you.
Thank you so much, Joy. I'm so excited to talk about one of my favorite topics, which is perinatal mental health. So, like Joy said, in addition to being a full spectrum doula, certified by none other than the National Black Doulas Association, I am also a licensed clinical social worker. So, I practice perinatal mental health with families across the state of Georgia, as well as some families in Florida and South Carolina for telehealth. So I'm excited to talk to you a little bit today about perinatal mental health and what that is. As Joy described it, it is also known as perinatal mood and anxiety disorders. And so something that I like to note is that perinatal mental health is not a luxury topic, right? This is a topic that is a core part of maternal, infant, family, and community health. So we're going to take some time today to break down the pieces of what perinatal mental health actually is, some signs and symptoms. Also got to get into the data because I'm a public health girly as well, and specifically speaking to Black women. And we'll also talk about perinatal mental health in men and non-birthing partners, some screening and prevention and early support things, and then any questions or key takeaways I'd be happy to present to you all. So just to note, perinatal mental health is referring to the emotional and psychological well-being during pregnancy and through the first year after birth. Some studies that you may come across could also suggest that the perinatal period lasts up to 2 years after giving birth. Okay. So perinatal mental health includes more than postpartum depression. So if you're familiar with me, you know my stance on identifying mental health concerns as just postpartum. Okay. So anybody who is giving birth is guaranteed to navigate through postpartum. Why? Because postpartum means the period after giving birth. Now, if you are experiencing any concerns with like your mood or your emotions, anything related to like hormonal imbalances, that could be a mood and anxiety disorder that is being exacerbated in the postpartum period. But identifying it as postpartum by itself is not enough and keeps people from getting access to the support they need. So I like to make sure that we're clarifying things and calling things by their name. So again, perinatal mental health is inclusive of depression, anxiety, panic disorders, OCD, trauma, so PTSD, bipolar disorder, and that is bipolar 1 and 2, and in rare situations, postpartum psychosis. And so to speak to the rarity, postpartum psychosis happens in every 1 to 2 people out of 1,000 persons. So it's super rare. Okay. As far as perinatal depression goes or perinatal anxiety, some studies suggest, but I'm going to give you an average here, 1 in 5 pregnant or postpartum women, and I'm using cis normative language because unfortunately that is what the data is related to. We need more information to be more inclusive and holistic. But currently, 1 in 5 pregnant or postpartum women experience depression, anxiety, or scary thoughts. That means that the prevalence of these are high, right? So, one of the biggest misconceptions is that mental health concerns only begin after birth, but actually, symptoms can start during pregnancy and they can continue into the postpartum year or years, depending on how you want to look at it, right? So the postpartum period is much longer than the traditional 6 weeks or the 40 days that's talked about, and many serious mental health complications can arise months later. So this is a note to say that perinatal mental health disorders can come up at any point within those first 2 years postpartum. So it's incredibly crucial for us, especially those of us who practice as doulas, doctors, clinicians in the therapy space, chiropractors, any person who's coming in contact with a pregnant or postpartum woman. We should be hyper aware of the onset of these types of disorders. So in a study that I pulled up, this was done by 14 U.S. maternal mortality review committees. 63% of pregnancy-related mental health deaths occurred between the days of 43 to 365 days postpartum. That is a huge range, but also a charge to show you why long-term support matters, because these things can come up at any point, okay? So again, the conditions that we're referring to, we're talking about depression, anxiety, OCD, trauma, PTSD, bipolar disorders, and postpartum psychosis. So this is the full broad picture of these perinatal mood and anxiety disorders. And I would, of course, love to go more in depth about those things, but for the sake of today, just wanting to highlight that what we're talking about in this space are those disorders, okay? So the ACOG guidance on screening and diagnosis covers depression, anxiety, bipolar disorder, suicidality, and postpartum psychosis, okay? So what we're not trying to do in this space is cause people to be afraid of normal emotions. So when I say normal emotions, I'm referring to the phenomenon known as the baby blues. So within the first 2 weeks after giving birth, right, it is not abnormal to have some emotional fluctuations, some up and downs, some feelings surrounding either feeding or changes to body, things of that nature, irritability. All of those things are normal within the first 2 weeks, right? But if those types of symptoms of irritability, overwhelmingness, unexplained crying, things of that nature continue, then it should keen our ears to be questioning what's going on with our client, what's going on with this pregnant person, okay? So we want to be able to be in a position to recognize when distress is persistent, when it's impairing their ability to live their life, when they're afraid, or if things are continuing to escalate. So again, to speak about the commonality of these things, about 1 in 5 pregnant or postpartum folks experience mental health symptoms, okay? About 1 in 8 report postpartum depressive symptoms, according to the CDC, okay? And these rates are going to vary based off of previous risk factors and by population, okay? So there's data from the CDC that found that 13.2%, or about that 1 in 8 of folks reported postpartum depressive symptoms. The prevalence varies by state and by maternal characteristics, okay? These symptoms are also more common, according to this study, in folks experiencing IPV or intimate partner violence, those who engage in smoking, prior diagnoses of depression or bipolar disorder, socioeconomic stress. So as a social worker, person and environment is very big. What's going on around them that's affecting their current mood and emotional expression. And it was also higher among non-Hispanic Black respondents in comparison with white respondents in that exact same analysis. So as we can see across the board, there are disparities when it comes to Black and brown folks in this space, okay? And so some important things to note is that it can look like a myriad of things. So if we see any of these types of things come up, this is something that should warn us to have further conversation with folks that we care about. So sometimes it's flat communication patterns, like very stoic, lacking emotion, things of that nature. Maybe they seem a bit more detached or angry or frustrated, hypervigilant about the care and only wanting to be the sole person to do things, or deeply ashamed, right? Sometimes anxiety can show up as constant checking. So, ooh, let me make sure baby's breathing, or ooh, let me make sure I turn this off, or ooh, I don't want to get too close to the stove when I have the baby because what if? It's a lot of what ifs that can come up. So that also is related to fear. So irrational fears or beliefs about something bad happening, racing thoughts, or panicking about these negative outcomes coming to pass, right? Depression can show up as exhaustion, hopelessness, guilt, or especially for Black women, this feeling of failing, like you're a failure, like you can't do anything right, right? That may be a sign of depression brewing. OCD, contrary to popular belief, is not about being anal, but it can involve intrusive, unwanted thoughts that often feel really scary or upsetting, right? And so these symptoms, while they are huge, they're big, they do not deserve to be judged, but it's really about offering compassion to people who are navigating through this space, okay? And this is why screening is super important. These concerns are super common, and they're also highly treatable, okay? So it's important for us to be aware about this as folks who are birth workers and professionals in this space, because untreated perinatal mental health concerns affects the entire family. And if it's affecting families, that means it's affecting communities. And so that's not good for anyone, right? So the CDC notes in a study that there's been associations with poor mental health associated with lower breastfeeding initiation, poor maternal infant bonding, and a greater likelihood of developmental delays. So again, it's not just isolated to a person, this is affecting communities and families as a whole, okay? So from a 14-state review, 11% of pregnancy-related deaths were due to mental health conditions, and 100% of those deaths were preventable. That is alarming. And it's heartbreaking. People are suffering, but either feel ashamed about reaching out for support, don't know where to turn, or folks have been turning a blind eye to them. And so we have to do our part to help, right? And I also want to note that this is a heavy time in general. And I know it's hard to be fed, negativity. Unfortunately, these are realities for us as Black and brown people, right? And especially for Black people in America, and where I'm located in Georgia, we're constantly failing in the maternal health department, and those things can be scary. But I do want to reiterate that there are supports out here available for you. Specifically in Georgia, we have the Georgia Fund, which today, the Georgia Fund application process opened up for anybody who is a Georgia resident to receive 10 fully covered sessions with a licensed professional, typically someone who has perinatal mental health certification as well, to help support you through this journey. And this is for all persons in the family in the caregiver role. So I just want to make that shout out that is available today. So, and specifically speaking about Black women in perinatal mental health disparities, there is a disproportionate burden, as we're already probably painfully aware of. That disproportionate burden exists just like it does for general maternal health, the same way in perinatal health. Black women in this space as well are 3 times more likely to die from a pregnancy-related cause than our white counterparts, okay? There's also research that supports higher rates of perinatal anxiety and depression among racial and ethnic minority women. Along with that includes major barriers related to access, stigma, provider bias, and fragmented systems of care. This information I've got from the CDC, and I think is very important to highlight because even in the face of insurance, it's extremely hard to get paneled with insurance to cover these services, and it makes the gap wider for those who need access to quality care. Okay. So I want to be very meticulous when I share this information, right? The information I'm sharing from a statistical standpoint when it comes to Black women, the information varies based off of a couple of things, right? It's depending on the sample that was used in these studies and how the symptoms were measured, okay? So in a 2024, so this is pretty recent because we're in 26 right now, 2024 analysis of 7 U.S. jurisdictions, 16% of Black respondents reported early postpartum depressive symptoms compared with 10.9% of white respondents. That same study found that among those with symptoms, Black respondents were very much likely to not get mental health care than white respondents. So 37.1% of Black respondents got mental health support in comparison to 67.4% of white respondents. Okay. We also see that about 29 to 44% of Black women report having postpartum depressive symptoms. It's also really gut-wrenching to note that people are having these symptoms and it is reported as such, but these are also underreported because there is fear and mistrust of the system. This is just a nod and a note to say we have a lot more work to do, okay? So when I talk about this prevalence in Black women, I want to be accurate and honest. Nationally, rates are clearly higher than they are in white women. And in some higher risk Black communities, the burden is dramatically higher. So this is a public health concern, okay? This is an epidemic. This is affecting communities and families and their abilities to live good, holistic lives. Okay. And the reason that these folks are consistently missed, it's truly about recognition and treatment. Okay. Systemic issues are real. Okay. People do not have the same access to the same types of care. And so, again, I say there is more work to be done. But I'm bringing this to the forefront and to bring attention and awareness to this so that it can get you thinking, so that you can start doing your part in advocating in these spaces, just as I do. Okay. So I did want to make a nod to men and non-birthing partners about their exposure to perinatal mood anxiety disorders, because yes, it does happen to men and non-birthing partners. Okay. So about 1 in 10 of non-birthing partners or fathers experience PMADs. So if there's a group of 10 men or 10 non-birthing partners, one of those out of that 10 is probably dealing with a PMAD, okay? So 5 to 10% of new fathers report experiencing perinatal depression, and 5 to 15% experience anxiety. So what that can kind of look like for men is avoidance. So if we start to see them doing other things than interacting with the baby, like maybe picking up a house project that they had left down to the wayside for years, but recently decided to pick it back up, that's usually a cause for concern, and I'm asking questions. Or if we have someone that's always trying to do something away from the house, and I have clients reporting, feeling like they're carrying the sole emotional load, you may need to check in on that partner and see what's going on. So I just wanted to give that note there as well regarding that. Now, the biggest thing is, how do we screen for this? Okay, so screening during pregnancy and postpartum is extremely important. I personally think anytime you see somebody in this space, you should be screening them for this. There is a postnatal depression scale called the Edinburgh Postnatal Depression Scale, or the EPDS. Acronyms always throw me off, right? that can be used by anyone. It's a screening tool. It is not a diagnostic tool. You get diagnosed in clinical therapeutic settings. But screening should be happening during pregnancy and postpartum, right? You should also be able to provide real follow-up for folks who may have screened positively, as maybe they're navigating through something. You should be able to provide them with a list of resources in your area to be able to support them in getting the supports that they need, okay? General rule of thumb here is if we're doing screening, it needs to happen at least at the initial prenatal visit, later on during the pregnancy, and at postpartum visits. If someone is listed as high risk, they should be being checked as often as they are having to report to the office for visits. So that is my general recommendation. ACOG typically recommends the same. So let's talk about some prevention, protective factors, and then also if we need to escalate it further. So, of course, prevention and protective factors is being in counseling for individuals who are at an increased risk. So those who have a history of depression, anxiety, or bipolar disorder. Also making sure to set up effective and well-rounded community supports and social supports, being able to clearly communicate what you need from those around you so that they can offer that help and support. Also, sleep protection. So when I say sleep protection, I'm meaning having those people around you that can support you in getting adequate rest that you can show up as the best version of yourself. I don't know if that's a doula, a nanny, your mom, sister, brother, cousin, whomever. We need to have everybody come back around and nurture this family that is growing, okay? And then also to partner and family education. Okay, that is all very important. The more you know, the more you're able to advocate, the more you're able to speak to the things that you need support with. Okay, sometimes things are beyond just having a therapy session or something like that. If someone is presenting with suicidal thoughts with imminent risk, right? So when I say that, I mean suicidal thoughts alone are not enough. We need to go a little bit deeper and ask more questions. If someone is presenting with suicidal thoughts, I always recommend encouraging them to reach out to 988. If there is imminent risk of causing harm to themselves, harm to the baby, if maybe they're experiencing hallucinations or delusions, or there is extreme out of character behaviors taking place, we want to escalate and get them some additional support, right? So check in on your area about the supports available for that. But sometimes we do need to escalate to care to get someone help in person so that they can stabilize and feel better and show up for themselves and their babies, okay? So all things said, these are common but treatable disorders, right? And they're also deserving of attention, right? I think a lot of times mental health can play on the back burner. But when I tell people, I say the same things that you will do to make sure that your physical body is good are the same things that you should do to make sure that your mental body is good. We often look and treat the brain and the mind as separate from the body, but it's all in this same cavity. So we need to do the things that help support us being well overall and holistically. So that's all I have for you today for this masterclass. Please let me know if you have any questions. But that's that.
Thank you so much, Imani, for that powerful and insightful session. We're gonna get into a little bit of Q&A. So if you guys have any questions, feel free to drop them in the chat. But I'll go ahead and start us off with our first question. So, Imani, what falls under perinatal mood and anxiety disorders, and how are they different from what many people consider as normal stress?
That's a really good and loaded question. So, perinatal mood and anxiety disorder would be those things I described. So it could be depression, anxiety, OCD, PTSD, bipolar 1 and 2, psychosis, panic disorders. It can show up in those ways. The difference in it being regular stress, I think the key thing to be mindful of is if this is something that is altering your normal life, right? It's one thing to have normal anxiousness, and I'm an anxious girly by trade, okay? but it's something when that anxiety becomes crippling and it keeps you from being able to function normally in your day-to-day environment. So that's the biggest thing to look for.
Thank you so much, Imani. So, my next question would be, how can symptoms present differently in Black birthing people, especially considering stress, bias, and barriers to care?
Yeah, so I like to think of it as the way we speak about things, right?
Mm.
So whole time our parents was out here saying, "Ooh, my nerves are bad," or "Ooh, I
Yeah,
need to do X, Y, and Z." They were really describing anxiety. But in our culture, we just didn't really put those words on it, right? We're not
yeah,
going to put those things out there or say those things are happening to us. And also, too, another point that I made earlier was that a lot of times for Black people, it feels like failure.
yeah,
Depression feels like failure. So that's how it can show up. A feeling like, man, I can't do anything right. This self loathing, right? It can also come up like that. We also see in Black women specifically a lot of high functioning depression. And that is because we've been conditioned to think, hey, I can't let people see me sweat. I got to keep going, even if I don't feel okay.
yeah, exactly. Love
Mhm.
that. Thank you so much. And then my last question is, how should doulas approach screening informally without diagnosing?
Great question. So, all of the tools that I mentioned today, the Edinburgh Postnatal Depression Scale, those are all screening tools, not diagnostic tools. So, when we say screening, what we would posture our conversation with our clients to be would be, hey, based off of this, it's looking like you may be dealing with this. I'm wondering if we can get you connected to someone who can talk to you about this further and give you an official diagnosis. So, always position it as this could be presenting right now based off of this tool that we utilize. Let's get you connected to someone who can confirm.
Alrighty. Well, thank you so much, Imani, for an amazing masterclass. I'm just gonna leave us with a few announcements. I see a couple people in the chat. Thank you for joining. If you're wanting to get connected with the NBDA, go ahead and DM us. You can email us at hello@blackdoulas.org. But in general, we always have these events monthly. So go ahead and check out our events page. It'll show you all the events that we have coming up. Currently, we have Journey to Doula World on April the 15th. That's for aspiring doulas or new doulas who just want to get connected to the community. We are also having membership orientation on April the 8th. If you're interested in joining the NBDA's membership, this is a perfect event for you to come to learn what your membership will include. And then last announcement, we have just went live with our Black maternal health virtual care packages. So if you are a doula and you would like to sign up for this free care package, go ahead over to our bio, click the link, and sign up for that virtual care package. We have some amazing offerings, scholarships, as well as just general codes, discount codes, and things like that. So thank you all. You have a great one, and we look forward to seeing you next month.